LSP Half Back is a rugged and versatile spinal immobilization device that provides vertical lift capability without the need for a separate spine board. The unique device allows for rapid spinal immobilization as well as vertical extrication of a patient to remove them from confined or elevated spaces. There are many common environments that a product like this would be ideal for, and that includes construction sites, lower decks of marine vessels, storage tanks on trains or on boats, as well as many other environments, really anywhere where rope rescue of a patient may be needed that it has suspected spinal injuries. What makes the LSP Half Back unique is that it combines the capabilities of a full body harness as well as the ability to mobilize the patient if spinal trauma is suspected. The device is really interesting because it consists of two main parts. The first of which is the full body harness, and then secondly and independently there is a removable backstay. And the two-piece design has some distinct benefits. First of all, when the backstay is removed, it makes the harness easier to put on the patient if they're in a confined space, as they usually would be when they're injured. And so because it's flexible, it can fit around the patient, and you can do this with minimal movement. Secondly, having the immobilization part of this separate from the body harness part allows in risky environments, high-risk environments like oil rigs or something like that, the user can actually put the harness on and use it as a full body harness at all times. And if injury occurs, then immobilization becomes just as simple as putting in the backstay and just tightening the straps. So it's a very unique design, and it's intended, like I said, specifically for immobilization of a patient where in a confined space where vertical lift is going to be needed.
The halfback comes neatly stored in its storage position. The first thing that needs to be done is to remove the Velcro straps to free the leg straps. Once the leg straps are free, the device can be opened up and positioned underneath the victim. The vest will be inserted until the patient's shoulders are aligned with the shoulder straps. Next, you'll take the torso portion and undo the red torso straps and connect the top strap with the top buckle. You'll note that both the top and bottom torso straps are both red, and the buckles of these straps are color-coded. The top one is black and the bottom one is bright silver, so they can't be mixed up. You're going to attach black to black, silver to silver. Once the torso straps are attached, we'll then attach the shoulder straps. Again, these are color-coded buckles. Bright silver goes to bright silver, and on the other shoulder strap, black buckle goes to black buckle. Once the shoulder straps have been applied, you'll then go and apply the leg loops. Now the leg loops will go from the outside of the leg around behind the knee and inside to make a sit harness loop. And you'll notice a buckle at an angle, again color-coded, black buckle to black buckle. And on this side it will be a bright silver buckle. And again, you go from the outside of the leg to the inside of the leg to create a sit harness type configuration. And again, you'll connect silver to silver. And once those are tightened up, you're able to attach the head harness. Spine immobilizer. I've taken the head harness off just for ease of demonstration here. The backstay is then slid into the pocket in the back of the vest and attached using the Velcro straps. Once the head harness has been attached and tightened down, you will then want to immobilize the arms so that they don't come loose during the vertical lift process. These are done with the thin Velcro straps that are on the side of the torso. Once the arms are immobilized, you'll then use the two D-rings in the middle of the chest to attach the vertical lift strap. Again, this is the Allied vertical lift strap, but you can use any vertical lift strap that you have with your department. And as you can see, as the patient is lifted, he maintains a vertical body position because the legs balance out the rest of the body, and he can be safely lifted from his location. This has been an overview and demonstration of the L720 vertical extrication device.